Namaste, Vanakkam, good afternoon. So we are going to start the afternoon session, the paper presentation for the National Conference, Holistic Healing Through Yoga Therapy. The first speaker is Dr. Mani Kattapillai, Professor of Anatomy from Sathya Sai Medical College. And for today's paper presentation, the juries are Professor Janit Sir, Professor of Physiology Department, Mahatma Gandhi Medical College, and Dr. Lokesh Maran Sir, Associate Professor of Biostatistics, Department of Community Medicine. So you'll be given 5 minutes time to present it. After that, 2 minutes. If the juries have any question, they will ask you. So 5 plus 2. That's your timing for today's presentation. As usual, our sir is very soft-hearted. He has to give 6 plus 2 minutes. Okay.
Very good afternoon to you all. I'm going to talk to you about the awareness about yoga asana among undergraduate medical students. Even though the yoga asana or practices of yoga was practiced since 5,000 years, and in our India being the birthplace of yoga, the benefits of yoga has not reached widely as we expected. The reasons being lack of awareness, interest, and misconceptions. Misconceptions in the sense, we usually think that the yoga practices are only for sadhus and sannyasis. And in recent years, it gained momentum, especially by the voice of our Honorable Prime Minister at the United Nations General Assembly during 2014. And most of the complementary and alternative medicine are having yoga as a whole or part of their curriculum. Our primary aim of the study is to know the awareness and benefits of yoga among the undergraduate medical students. Objectives are knowledge and timing of yoga. Secondary objectives were reasons and motivation for doing yoga. The study was conducted at Sri Sathya Sai Medical College and Research Institute, Ammapettai, Chengalpattu. Among 149 students, first year MBBS students, the method of collection of data with the validated pro forma, which I will be showing due course. The design of the study is descriptive, cross-sectional, and it happened for a period of 2 months. Yes. Regarding the knowledge of yoga, around 88% opted, 88% were knowing about the knowledge and benefits of yoga. And regarding habit and whether they have consulted any professional about yoga, it was around 30 to 40%. The reasons for doing yoga, whether being fitness or it is good for external appearance, it's good for internal organs, and it's good for mind, it ranged from 70 to 90%. And regarding timing of yoga, 85% of the students answered rightly as early morning. Motivation from self as well as TV, media, family members. This also range from 40 to 70%. In conclusion, habit and consultation about the yoga, if they don't know the benefits of yoga, were very less, whereas knowledge about the yoga is around 85%. Then reason, timing and motivation of yoga. Timing, 85% of the students were right. That is, they answered the early morning practice of yoga is the right time. Then being the first year students, they were stressed the most as per the record. It is good for all the students of medicine. Then it is suggested that this yoga practice should be included not only during the foundation course of first year. It should be within the curriculum of the MBBS students, at least 1 hour per week. So this paper has been published during 2019 in the International Journal of Yoga, Physiotherapy and Physical Education. So this is the proforma with the 6 variables. And I have been practicing this yoga asana for the past 43 years. These are some of my postures.
Dr. Mani, congratulations on doing this project.
Thank you, sir.
I have few queries in this project.
Yes, sir.
One is like you have did the study as a questionnaire based study.
Yes, sir.
Right. Can you share the questionnaire rather than the tabular column which you have shown a pro forma?
Yes, sir.
It
Yes,
says yes or no. That's it.
yes, sir. Yes.
So is there any
No,
other
no response. That also included.
yes row and no response? They don't want. Is there any validation process which you followed for this? What if a student feels that yoga is good, but still he does not wants to say that it is good? I feel yoga is good.
Yes, sir.
Another person says yoga is not good, but I don't want to say that it is good. So I put my response as no response.
That is up to their interest.
No, actually, then what happens is like you will have to find for the validation
Yes,
of
sir.
each
Yes, sir.
questionnaire. So you will have to find whether it is true, whether the person is saying it true, there is lies. So it's like
This
basically
is
like
same, the questionnaire is available. It is same study is done in Andhra Pradesh.
then you
same
will have,
steps.
then you will have to ask permission from them before using their questionnaire.
Yes, sir. Yes, sir. I have asked, sir.
You need to
From-
submit
yes,
those
yes, sir.
details.
Definitely, sir.
Next thing, because it was in your study, you said that it is a validated questionnaire.
Yes, sir.
That is the reason why I was asking you, how did you validate this?
Yes, sir.
Second one is, it is just knowledge. It is just you are checking whether the person is aware of yoga or not.
Yes, sir.
Right?
Yes,
No
sir.
other concern, no other intervention was given.
Yes, sir. Yes, sir.
Is there any other way where you can improve the knowledge of improve this study?
So we
Quality of the
have,
study?
so we have to make them aware, sir. In percentage, I have
If you
represented.
shown percentage, it'll be easy for us to what?
Okay, sir. Okay, sir. Accepted.
Thank you.
Thank you. Thank you. Thank you all for your patient hearing.
The next speaker is this one, design, this one. Yes,
Can I use this?
You don't want to use this.
Okay, so good afternoon all. I'm here to discuss about the module which we have developed. And the title says design, development, and validation of customized mind-body module towards resilience building and wellness promotion among healthcare workers. So I guess most of you here are healthcare workers, right? So has anyone here have been into postings into clinics or yes? Who are they? Can you raise your hands? Okay. So what was the work environment was like? Stressful. Okay. So what about the working hard? Yeah. 3 to 4 hours a day. And how was it? Like, how was your health? Were you able to cope up with the stressful environment? Yeah. So actually, this is a module which we have created to build resilience among the healthcare workers. So healthcare workers are dedicated individuals who are at the forefront of providing care and support to those in need. They usually work for long hours under stressful conditions, and they even have the fear of being infected. They have been put into a situation where they need to take a critical decisions regarding the life and death of the patients, and there are more of the different challenges they have to face during their working environment. So healthcare workers are majorly put into high risk of experiencing mental health problems. And as a consequences of these, there is increase in the absenteeism of the healthcare workers in the clinics. There might be a clinical errors. There will be a reduced productivity and poorer quality of healthcare. So what can be done to prevent this? Or how can you manage it? You cannot, reduce the stressors which is in your work life. So what can be done is you can focus on your own health. So, and since Atonsky's salatogenesis theory concept was founded, the basis for health promotion and the idea of resilience has been, it's been increasing extremely, and the number of researchers that's been on this field is increasing. So we all know what resilience is. It's the ability to cope up with stress and handle stressful situations. So it refers to the phenomenon in which a person does not or experiences only a brief mental health difficulties despite being exposed to psychological or physiological challenges of short term or long term. So this study is done to design, develop, and validate a resilience building module for the healthcare workers that incorporates mind-body practices. And the objective of the study would be to identify mind-body practices which improves resilience and wellness promotion. And the second objective is to develop a customized module for healthcare workers towards resilience building and wellness promotion. So coming to the methodology, we have adopted a 23-item checklist and guidelines, which has been developed by Ketla et al. And the reference has been given in the end of the slide for the module development and validation. So this is the stages of module development which we followed. The first thing is a literature search, followed by data compilation, and then circulation of compiled practices to the to experts, and then analysis of the report, validation of the protocol, and selection and regrouping of the techniques into weekly practice module. So the first step is literature search. The literature search has been done in PubMed, Google Scholar, Cochrane Library, and ResearchGate. And it has been compiled into multiple key areas. So these practices were then circulated among the field experts. We have for this study, we have circulated the compiled practices to 8 different field experts whose designations were professors in medicine, assistant professor in psychology, medical officers, yoga demonstrators, lecturers, professor and associate dean, founder and CEO of Emerging Fit, executive coach. So all the experts are about 50% of the experts involved in the study has more than 15 years of experience in yoga, and about 25% have 11 to 15 years, and about 25% have less than 5 years of experience in yoga. So this is the responses which we got. The 1, 2, 3, 4, 5, 6, 7, 8 are the different experts which are involved in the study. And they all, apart from the techniques and the practices which is given in this table, such experts also suggested to include other techniques such as Bastrika Pranayama, Ujjayi Pranayama, Anulom Vilom, and then deep breathing. So the ones which are marked as stick is essential, and the one which are marked as dot is essential but can be avoided, and the one which are marked as into is not essential. So, and then comes the validation of the protocol. So for this, we have used Loshley's content validity ratio formula. So CVR is content validity ratio, and NE is the number of panel members indicating the, these are the compilation of the CVR of the practices that has been included. And the next step is, this is the final module which has been designed and developed, and the duration has been given suggested by the experts. So this is actually framed as 8-week module, and this can be used for resilience building and wellness promotion. So when one focuses on biological, psychological, social, and spiritual variables and processes at every stage of life, one can regulate the relationship between stress, trauma, and sickness on one hand, and be a beneficial and desirable outcome on the other. Taking care of one's mental health can occasionally aid in the prevention of some medical conditions and can even speed up the recovery time. So we need to pay attention to our emotional and mental stress so that we can support our own health and others in a long term. So this study has developed a mind-body module to build resilience in an individual, which will be of great help to them in handling at any situation. So thank you.
Yeah, Harita,
So
I must congratulate you for developing this module. And you have followed all the steps for developing the model very perfectly.
Thank you, sir.
And I would be so happy to see the result of this.
Sure. So there is
result of this module coming out.
Yeah.
It was so good.
Thank you, sir.
Only thing, it should have been implemented, and if we are able to, if we can see some result
there
out
is
of
a
it, will be
follow-up
much
study
better.
with the protocol which has been developed. So the study is almost done, and we need to analyze the the data.
All the best.
Thank you so much.
Have you calculated CVR value? That CVR you showed.
Yes, sir.
Calculated?
Yes, sir.
Which one? What is the value for that? Have you got any value?
Yes, sir. The one which is above 50% that have been included in the module. The one which is lesser than 50% has been removed from the module.
So each and every one.
Sorry?
Each and every one you are calculated
Yes,
that value,
sir.
and you are included.
Yeah, it's been
for
put
that.
up in the tableau.
Fine. Okay. Good luck.
Thank you, sir.
Smriti ma'am, please come.
Good afternoon. Myself Smriti. I'm a doctoral research scholar at Ramchandra University. And I have done a small pilot in investigating the efficacy of animal assisted yoga therapy as an intervention for dyslexia. It's actually a small pilot study and the participants are really small. So we wanted to know how this yoga therapy is efficient for coping up the challenges faced by the dyslexic kids. So I would like to tell you the different neurodevelopmental disorders that are prevalent among kids nowadays. So autism, dyspraxia, dyslexia, sensory processing disorder, and ADHD were prevalently found, but we included only dyslexia and a part of ADHD. So dyslexia, as you all know, it's a learning disorder that involves difficulty in reading and is most commonly found in children who show symptoms of trouble spelling, tend to mix up words, and difficult remembering and writing. So this condition is chronic, but individuals with dyslexia can be helped to cope up with condition, but you cannot overcome that condition. You can just support them with additional tutoring, cognitive training. And this, instead of using the regular therapeutic approaches for dyslexia, we tried this unique therapy, combining animal assisted therapy along with yoga therapy. So this animal assisted therapy might sound new to you. I would like to explain that. So animal assisted yoga therapy is a therapeutic approach that combines the benefits of yoga practice with the presence and interaction of animals. So for this study, we used only dogs aging from 45 days to 2 months. They were all small puppy dogs. They were running around when the yoga therapy was given, and the kids had a chance to hold them and play with them while the therapy was administered. This presence of these animals help create a calming and supportive atmosphere for fostering a sense of trust, comfort, and connection, improving their visual motor integration and sensory feelings. So the study aims to investigate the efficacy of animal-assisted yoga therapy as an intervention for children with dyslexia, focusing on its impact on visual motor integration. Since for the dyslexic children, the visual motor integration is reduced in few dimensions according to the age, so we focused on that. And this visual motor integration was assessed using a Berry Butonica developmental test. It's actually a battery of tests which will have sensory modules, visual modules, and hand-eye coordination. It is basically drawing, coloring, and basic stuff for the children. So the participants were dyslexic children aging from 9 years to 13 years, and only 50 participants were selected from local schools and dyslexic support organization. Informed consent from the parents and the legal guardians were obtained. For this module, we had two groups. One was the experimental group, which received the animal assisted therapy, and one was a control group, which received the traditional dyslexic therapeutic programs. And this yoga therapy was posted for only 6 weeks. Posted for only 6 weeks time. And we analyzed the data using t-test, paired sample t-test and ANOVA to compare the mean difference between the two groups. So the results post 6 week gave us that there's a significant and positive impact of animal-assisted yoga therapy on visual motor integration in individuals with dyslexia. Pre and post intervention assessment using Berry Butonica developmental test of visual motor integration show that a statistically significant improvement in VMI scores, and the P was 0.005 following the animal-assisted yoga therapy intervention. For the control group, the significance was there, but not comparatively higher than the animal-assisted therapy. It was normal. So the participants who underwent the animal-assisted yoga therapy program demonstrated an enhanced ability to copy geometric shapes, draw designs from memory, and match them with visual stimuli. There was a significant improvement in dimensions of visual motor integration, which promoted smooth hand-eye coordination, calmness during a task, and improved concentration. So to conclude, the positive and significant impact of visual motor integration suggests that AAT can be a valuable addition to this traditional dyslexia intervention, offering a holistic, engaging approach to support individuals with dyslexia in their motor and skill development. So I would like to highlight on the implications of the study. It was a new and unique therapeutic approach, which gave them a lot of confidence, and they were very comfortable. Children were very comfortable, and they did not have the fear of dogs. And since this had yoga and also this animal therapy, which focused on the well-being as well, psychological well-being and the emotional well-being, all that. So we found this as a holistic approach. And considering the psychological well-being aspect, emotional aspect and this confidence were also increased. We were able to communicate with the children properly, and they were able to form sentences when they were able to talk, when we asked for feedback. Moving on to the limitations, sample size and generalizability. We only picked 50 children having only dyslexia and mild ADHD symptoms. We were not able to go into other comorbidities, and we have not generalized it to a bigger population. That was one limitation. And duration of the intervention was only 6 weeks because we had only permission to do only that much. And measurement, we found the Berry Butynica test appropriate for the age and for the population we had. We were not able to find other tools which the children were able to replicate and copy and give us the results. And post 6 weeks, we were not able to follow up since we had only permission from the legal guardian or the parent for only 6 weeks time. I would like to thank MDA for giving us this opportunity, and Pas and Prana for assisting in the animal assisted yoga therapy. Thank you.
Congratulations, with the study was full, but how positive are you towards your study? Because the moment you started the study, you were saying like, you're using words like only 50 students, only for 6 weeks. Say that finding 25 students with dyslexia is very difficult. So you attend your study. So it is like you will have to be proud that you have found 25 students and you worked on with it. So be very positive in it.
Sure.
And giving intervention for 6 weeks is so good. I think it's proper duration. It has been. But let me ask you this question. How will you contradict the point that your study, the effort which you have seen is not, I mean, I may contradict saying that the effect is only because of animal or it is because of yoga. How will you contradict this point? Suppose if you would have had 4 groups,
Okay.
say one group, your control group, second one, dyslexia with dyslexia kids being given yoga therapy alone, dyslexia kids treated only with, I mean, allowed to play with only with animals, and the last group where you will be giving yoga plus animal therapy, animal for the students with dyslexia. That would have worked out much more better. And you can also give a concrete solution saying that, yes, the result is because of this.
Okay.
Rather than having 2 groups. I think that is the limitation of the study.
Sure.
Grouping. And age group. Can you say me what was the age group of the students?
9 to 13 years, sir.
All were 9
Yes,
to 13
all were 9
years.
to 13 years. 25 boys and 25 girls.
Okay. Nice study.
Thank you, sir.
Statistically, I couldn't find any tables in your slides.
Yeah, I have not obtained permission to post the statistics yet, so I was just asked to explain it with points.
No, I don't want the exact values. You can put some average value that you applied, no?
Okay.
The t-test value and other things.
Okay.
So dyslexia, we already know this under the, like, what you call not normal values. It is below the normal values, abnormal values only. So if you are putting like some average value or something like that, it will be very good to assess.
That I'll include.
And you showed and you spoke about like a control group also having some significance, but not that much.
Yeah.
What it is exactly?
AAT had almost 95% significance, and with the regular control
Treatment.
group, yeah, we didn't include anything. It was just the reading practice, writing practice, and the dance movement and all. It's a regular everyday activity that we did. So it was not much. They were bored because they do it every day, and we were not able to include anything unique for them, and their attention span was less with regards to the daily
But
routine.
anyway, you found finally it is also somehow showed
Somehow there's some improvement with kids who are able to concentrate more, but not with everyone. Actually, we observe in class, when we give that, it was not there much. They were distracted every day when we say open your books, we'll do this exercise and all.
Where you got the idea like animal assisted yoga therapy?
I have been around pets from my childhood, so that was my personal inspiration. And I watched a lot of movies on that. So yeah,
Okay. That's good. Thank you.
thank you.
Thanks to Tare Zamain Par.
Now this animals at yoga, it's not related much to this. They do now yoga and this, all this bear yoga, all that. But cow therapy is now, cow therapy, it's become very popular there. And that becomes more psychological than yoga. What I remember now, long back, because I'm an ancient man, no? There used to be one K.N. Udupa, who became, he's an Ayurveda man. You heard about him, K.N. Udupa? Ayurveda man, he became director of Medical College Institute, BSU, very big man. What he did, I remember the paper, Indian Journal of Physiology of Mukherjee. And what he did, he put the mice in test tube. What's the point? Mice in test tube with connection with the ECG cable, inverted test tube, and then published this paper. I have also done that work, not yoga. I've done effect of posture on the ECG. But he has published effect of Shirshasana on this ECG. It is not Shirshasana, it's a held up kid. And that time, K.N. Udupa, you heard about his name? Very famous. That this Indira Gandhi was there, no? This Swami Indira Gandhi. Dheerendra Brahmachari. He's a very powerful man. Then he saw that he made this fellow making the right Shirshasana, I'll stop all the right to him. I don't know what happened afterwards. It's published in Indian Physiology Pharmacology paper. Anyway, thank you.
Thank you, sir.
I too remember you saying during my start of PhD, it was Sir's idea to do Sirasasana in animal. Lucky I did not get cursed.
The next presenter is Dr. Sumitra.
Okay, good afternoon, everyone. I'm Dr. Sumitra, Associate Professor in the Department of Physiology in Karpaga Vinayaga Institute of Medical Science. The study is effect of Om chanting on heart rate variability in healthy volunteers. Inhale. I'll control. Okay. The study is effect of Om chanting on heart rate variability in healthy professionals. So the present age of speed and competition has increased the stress and strain. It is resulting in lifestyle related health problems such as obesity, diabetes, hypertension, and coronary artery diseases. The cardiovascular disease has become a major cause of mortality in developing nation in the age group of 30 to 69 years. The cardiovascular mortality due to hypertension is seen more in developing countries. So the factors contributing to high level of stress in professional colleges could be highly due to competitive curriculum, intense academic competition, and excessive demand on coping abilities in physical, emotional, intellectual, financial, and social terms. Possibly these and many more factors contribute to the high level of stress in the medical students. And with the above facts in the mind, the relevance of yoga in medical education was evaluated. Om chanting is one such technique that can really reboot our anxiety from the entire world. The daily practice of this yogic practice can also be helpful for stress, anxiety, and other types of mental health complexes and disorders. And Om chanting, as we know, it elevates the stress, but the gender-specific difference in the beneficial response elicited by Omkara on heart rate variability is not clear. And therefore, this study has been undertaken to look at the significance difference in the autonomic modulation between the males and females on Om chanting. So the objective of my study is to assess the effect of Om chanting on heart rate variability in males and females. So the subjects were first year MBBS students who were volunteering for the study from the Karpak Vinayaga Institute of Medical Science. And the sample size which we took was 60 undergraduate students, and both males and females were equally divided. They were under the age group of 18 or 19 to 20 years, and they were recruited for the study, and the ethical committee have given the approval. So we have taken the MBBS students based on the inclusion is age group, and the exclusion is if they are already practicing yoga, they were excluded, and any diseases like history of any diseases which is going to alter their heart rate variability, those people were eliminated. And after that, we have divided them into study group and control group. In both the group, we had both equal number of males and females. Then we did heart rate variability. So we have an instrument called PhysioPack. We did the heart rate variability as a baseline thing. Then we have given for study group alone, we have given intervention, yoga intervention. Like Om chanting, we have given for 30 minutes per day for 4 weeks duration. And after that, they finished their intervention, we have taken both the study as well as the control group, and we have done the heart rate variability again. So this is the setup. So it is a 5 minutes recording procedure. So the subjects will be lying down and we will be connecting the instrument. And to record this HRV, we require only 5 minutes time. It is like ECG recording, as we are applying the ECG gel. After that, it will be recorded. And then we have the, in the software itself, we have the analysis, HRV software analysis thing is there. So if we click on that, we will get the report. So this, the report for each subjects, the report sheet will be like this. So finally, we'll take the frequency and the time domain and we'll do the statistics. So the data analysis was carried out by using statistical SPSS version 20. The data following the normal distribution was expressed as average mean plus or minus standard deviation. The level of significance were fixed if it is the p-value is less than 0.05. To assess the significance difference before and after yoga intervention, we did paired p-test. So we can see the parameters like heart rate, STNN, RMSDD. So these are the frequency parameters, and the time domain which we have taken is LF, HF and LF by HF. So if we see the, when we compare the study group and the control group, this is for the male candidates. So we can see the significance result, the heart rate as well as the HF. So this shows that there is a parasympathetic dominance over the males. Males have the parasympathetic dominance. And the heart rate, we can note that the study group from 73, it have been reduced to 62. So in case of females, from 70, it have further decreased to like 52. So females had good result when compared to the males. And here also we had the significance in HF. So this study shows that regular practice of Om chanting would be helpful in increasing the cardiovascular efficiency. And in this study, there is a parasympathetic dominance in both gender. And this study justifies the incorporation of Om chanting as a part of their lifestyle in promoting health and preventing the age-related cardiovascular diseases. And these are my references. Thank you.
Dr. Sumitra, again, yes. Congratulations. I have again a few queries here.
Yes.
One is like, you said you did it in first year MBBS.
Yes, sir.
What was the necessity to do it in a first year MBBS student? Since you are a physiology professor, teacher, and you've done it particularly on a first year student, why did not you involve the other MBBS students?
Sir, when we see like from the first year to the second year, I feel that the first year students are more stressed as they are coming out of they are joining one professional college for the first time. After second year and all, they'll be used to that campus and they don't have much stress.
So it was first year MBBS students who
Yes,
stayed
sir.
in hostel.
Yes, sir.
Right. Now, second question is, how many of them were from a non-Hindu background? Because this is Om chanting.
Yes, sir.
And I'm very sure here in SBV, we follow a very beautiful way of saying this. It is A, U, Im.
Yes, sir.
And the way it is pronounced, that is not going to create any cultural difference
Yes, sir.
or spiritual difference. But if someone is asked to say Om, maybe that may create some avulsion.
Okay, sir.
So that part you need to take care
Okay,
of,
sir.
right? And you said you were testing males as well as females.
Yes, sir.
So we all know that, yes, in females, because of hormonal imbalance, it does affects the heart rate variability. So was that taken into consideration?
Yes, sir. Their menstrual cycle was, we
But
have asked in history, sir.
No, not history.
But
but
no, sir.
that is very important.
Okay, sir.
Next thing is, at what time did you give the give this Om chanting practice, and who did that? Was it played via a record, or someone did and someone chanted it, and along with that the students also chanted
Sir,
it?
it was given in the evening time, sir, after their college hours,
Okay.
preferably 5 to 6, 5 to 5:30. So though we have given the training physically for few days. Then we have given the recorded thing and they have played and they have listened, sir.
So it was more like a record.
Yes. Sir.
Was there anybody who was monitoring whether the students were doing it correctly or not?
Monitoring, they did on their own, sir.
So there is no
Didn't
monitoring.
almost.
Fine. Because you said like it has been done for 30 minutes per day.
Yes, sir.
And for 3-4 weeks continuously. For almost a month, it should have been done properly.
Okay, sir.
This is one. Next one, the place of intervention, recording of, at what time did you record the HRV?
HRV again, we did in the evening time only, sir.
Should be done in the morning time in a dark environment.
Yes, sir.
All these things need to be considered before
Okay,
publishing
sir.
the paper. Thank you.
Okay, sir. Thank you, sir.
Shall I?
Yes, sir.
You spoke about like a 30 control group and 30 steady group. Boys and girls are equally proportional.
Equal, sir.
15 boys and
Yes,
15
sir.
girls. And did you capture any significance between boys and girls during this study?
So that's the values for girls were much reduced when compared to the males, sir.
Oh, that statistics I didn't see anywhere.
The heart rate, there were the difference, sir.
But
And-
your table shows like controls and experimental group. Those who are getting
So
intervention.
between the
Between
study
the-
group itself, I didn't compare, sir. Between the study group, I didn't compare. So physically, I'm just seeing the table and just
Oh.
telling, sir.
Because,
Statistically, I didn't compare.
This is the confounding factor where we
Okay.
have exactly difference between there is a significant difference between male and female.
Okay.
So you have to show that also. You have to identify, or you can find some significance between the gender base.
Okay, sir.
So that also you can consider.
Okay, sir. Sure, sir.
Thank you.
Thank you, sir.
So we would like to request our mentor, Professor Madan Mohan sir, to hand away the certificates to Matangi ma'am and Venugopal sir, please. Matangi ma'am. Venugopal sir. Janet sir and Lokesh Maran sir.
Great honor. Thank you.
The juries are receiving the mementos and certificate. எல்லாம் நல்லா கை தட்டுங்கப்பா. அப்பதான் அவங்க மார்க் போடுவாங்க. Thank you, sir.
Next speaker is Dr. Nivedita.
Good afternoon, everyone. I'm Dr. Nivedita, postgraduate first year from Department of Community Medicine. So I'm going to present a conceptual paper on effectiveness of multi-component skill-based training in promoting the healthy lifestyle practices and positive mental health among the school-going early adolescents in Pondicherry district. So India has the largest adolescent population, but the prevalence of obesity, the sedentary lifestyle, the substance abuse, the mental health problems are on rise in the world. So addressing these issues at the earlier part of life itself is very mandatory. But the traditional method of education, health education like behavior change communication, is not appealing to the millennials. So WHO defined a technique which is a skill-based health education, which is helpful in creating and maintaining a healthy lifestyle through the attainment of knowledge, attitude, skills, and behaviors. My aim is to ascertain whether this skill-based education is effective in promoting the healthy lifestyle practices and positive mental health among the school-going early adolescents. And my primary objective is that. And my secondary objective is whether the content delivered through the skill-based education, whether they can retain this content for a longer period of time when compared to the regular didactic lectures. So this is my research question: is adapting a multi-component skill base is effective in promoting this healthy lifestyle practices? So I have 4 components in my study. One is the physical health, the mental health, the healthy food choices, and the drug addiction. So this is my methodology. I have to get permission from the Directorate of School Education, and I have to stratify the schools into government and private, which is further stratified into rural and urban. So there are 4 stratas, and in each strata there are 2 schools. These 2 schools would be further randomized into control arm and the intervention arm. So I will be administering the pre-test questionnaire, which includes the socio-demographic details, the knowledge of the healthy lifestyle practices, positive mental health and addiction, adolescent health promoting scale questionnaire. One of the components which I have discussed earlier is a mental health. That related questionnaires are WHO-5 questionnaire, chronic stress questionnaire, and the pre-adolescent adjustment scale. In the control arm, we will be giving a normal, regular didactic lectures. Whereas in the intervention arm, regarding the mental health component, we are going to do the yoga demonstration with the help of my co-guide, Dr. Meena ma'am. Along with that, we will have a group discussion about the mental health related with the yoga activity. And also we will have any slogan competition regarding that. So after that, we will be administering the post-test questionnaire followed by 1 month and 3 months. So why we have taken the yoga as a component for improving the mental health is as yoga decreases the stress hormone levels and increases the good hormone levels like endorphins and GABA. So this decreases the anxiety level and it's going to improve their mood. So yoga is a combination of a physical movement, the deep breathing, the meditation and mindfulness. So because of the increased flexibility, it is going to improve the heart and the brain health and also improves the cognitive and the emotion improvements. So mental health, which is a very important topic, which according to CDC is emotional, psychological and social well-being. So it is important not only in the adolescent stage, but every part of their life. So why this topic has to be discussed in school? Because the school plays a major support system for the students. A mentally healthy student, they have a good problem solving skills, they will be engaging in various activities, and they have the readiness to learn and a non-aggressive behavior. So these are the practices we are going to demonstrate in the school with the help of my co-guide ma'am, starting with the simple warming up exercises, and which is followed by the asanas, which is going to normalize the physiological function. Then it will be followed by the pranayama, which is a regulated breathing for a circulatory respiratory complex improvement. And it is going to elevate the mood and creates a healthy attitude and results in emotional stability. So followed by finally by Shavanaza, which gives a peace of mind, and it is going to improve their awareness and relaxation. So this is the order of events which is going to be performed and the expected results. So the skill-based education will be helpful in improving the comprehension and retention of the health content, which is delivered through this method compared to the normal regular methods. So if it is found to be effective, it will be a novel method, so which can be implemented on a wider scale. So coming to the mental health component, so as yoga is going to improve the mental health, this technique can be adopted by the children, and it is going to reduce the stress, increases the academic performance and the emotional balance. So they will be engaging in many civic activities, and it will result in shaping a better society. These are my references, and thank you.
Nivedita, it is yet to see the limelight, right?
Yes, sir.
But your protocol is well framed.
Thank you, sir.
Who is going to give all this yoga therapy?
Dr. Beena, ma'am.
Beena madam.
Yes, sir.
Okay, fine. What will be the duration?
Sir, it is for a 148 hours, sir. So for yoga component, we will be giving 3 hours, sir. And we will be already arranging a module for that. So they will be practicing it for the next 1 to 3 months.
How
sir.
long? 3 months.
3 months, yes, sir.
Each session will be for?
2 to 3 hours, sir.
2 to 3 hours.
Yes, sir.
And this will be given during the school
Yes, sir.
timing or
Yes,
after
sir.
the school timing?
During the school timing, so we have to get permission, sir.
Okay, it is said to you have to get.
Yes, sir. Yes, sir.
Right. All the best.
Thank you, sir. Thank you so much.
The next presenter is Garima.
Good afternoon, everyone. Today, I'll be presenting on adjuvant yoga therapy for postprandial distress syndrome. So, for the background, postprandial distress syndrome refers to post-meal related symptoms originating in the upper gastrointestinal region. So, it comprises of majorly postprandial fullness and early satiety. It comes under the umbrella of functional dyspepsia, which is a disorder of gut-brain interaction. So, disorder of gut-brain interaction we'll discuss in a while. There is an intricate connection between the central nervous system and enteric nervous system, which is managed by majorly 3 pathways. We'll discuss them in a while. What I want to tell here is that along with physiological factors, psychosocial factors in these disorders play a strong role in patient symptom experience as well as the clinical outcome. So Rome 4 defines PDS as bothersome fullness in the upper abdominal region after meals or inability to finish a meal because of feeling full or satiated after eating little. The symptoms should be present at least 2 to 3 days a week for 3 months with symptom onset at least 6 months prior. And there should be no evidence of any organic or structural disease detected during upper endoscopy. And bloating, belching, and nausea may be present simultaneously. So as we discussed, these are disorder of gut-brain interaction. This disordered communication between gut and the brain can cause things like abdominal gastrointestinal physiology like slow gastric and duodenal motility, inability of fundus to completely relax, which will lead to impaired gastric accommodation, visceral hypersensitivity, altered mucosal and immune function, altered gut microbiota. In the modern medical management, we have proton pump inhibitor as a first line therapy if the patient is H. pylori negative. In case the patient is H. pylori positive, we have to give H. pylori eradication therapy. After PPI, if they fail, tricyclic antidepressant is recommended by ACG and Canadian Association guidelines as a second line therapy, and prokinetic if the above therapy fails. Aims and objectives. So the aim for the study is to evaluate the effect of yoga therapy as an adjuvant to conventional treatment in PDS patients. There are three objectives. First is to evaluate the effect of yoga therapy on total symptom score. Another one is to evaluate the effect of yoga therapy on quality of life in PDS patients. And third is to evaluate the effect of yoga practices on psychological parameters like stress, anxiety, and depression. This is the institutional human ethics approval. This study is a part of a larger study wherein 155 functional dyspepsia patients were randomized to standard medical management and adjuvant yoga therapy group. Now, after they were randomized on the basis of Rome-4 diagnostic questionnaire, they were further subdivided into EPS, PDS, and overlap subcategories during the analysis. Out of these, 31 PDS patients were there and they were assessed. 14 were in standard medical management group and 17 in adjuvant yoga therapy group. So they were assessed for gastrointestinal symptoms and quality of life. We used NDI for this and psychological distress at the beginning and 3 months after treatment. So this is the methodology. Patients who had undergone endoscopy and fulfilled the Rome-4 inclusion criteria. It was a RCT and place of study, School of Yoga Therapy, ISCM. This was the methodology. Inclusion criteria, the patients who fulfilled Rome-4 criteria, there should be no evidence of structural or organic disease, as we already discussed. Age limit 18 to 65 years, they should be able to perform techniques in the protocol. Exclusion criteria, majorly patients with some organic disease like peptic ulcer disease, gastroesophageal reflux disease, carcinomas, or patients with hypertension or bleeding disorders. So these were the tools used. Rome-4 diagnostic questionnaire and short form Nepean dyspepsia index were used to assess the symptoms of functional dyspepsia and to measure quality of life. Perceived stress scale, GAD-7 and PHQ-9 were used to assess stress, anxiety, and depression respectively. This was our yoga therapy protocol. So data collection, basically after fulfilling inclusion and exclusion criteria, and the subjects were randomized into experimental and control group, and after the informed consent was taken from subjects, pre-data was collected, and after 3 months of intervention, post-data was collected. Yoga sessions were conducted, 3 sessions in the beginning, which were supervised sessions, and after a gap of 2 weeks, another 3 sessions were conducted. Because in our protocol, we have some cleansing practices that should be done under supervision only. Then yoga videos were given for home practice and online sessions were conducted once a week via Zoom. So this was the protocol that we discussed, but because we had to turn the protocol into online because of COVID, we had to delete Kunjal and Agnisar that could not have been given via online classes. These are some sessions, offline as well as online, that we gave. Statistical analysis. Just for this study that I'm presenting today for PDS, median and IQR values were used to express measures of central tendency as data didn't pass normality. So we used median and IQR. And Wilcoxon test was used for within the group significance and Mann-Whitney for between the group. So results, our first objective, we'll come to first objective, to evaluate the effect of yoga therapy on total symptom score in PDS patients. So if we see both in standard medical management group and adjuvant yoga therapy group, there was a decrease in the symptom, which was significant. However, adjuvant yoga therapy was more significant than standard medical management.
1 minute more.
Objective 2, to evaluate the effect of yoga therapy on quality of life in PDS patients. So same, both the groups helped in improving quality of life, but yoga therapy was significant over standard medical management. Similarly, third objective, if we see the stress scores, standard medical management was not that significant in reducing stress. However, yoga therapy was, but when we do the intergroup comparison, there was no significance between the groups. For the anxiety, both the groups were significant. However, yoga was more significant than standard medical management. Depression, both were significant. However, there was no significance between the group. So discussions, how yoga therapy now could have helped the patients, as there are no studies on PDS with yoga. So yoga therapy can help in improving gut-brain axis communication bidirectionally. One probable mechanism by which yoga therapy seems to work is enhancing the vagus nerve tone and parasympathetic tone. So like in the beginning, we discussed, there are 3 pathways for gut-brain connection. One is through addressing vagal nerve tone. Then yoga is hypothesized to work by down regulating sympathetic tone as well. Also increased hypothalamic CRF levels have been reported in FD and which is implicated in inhibiting vagal efferent activity. So role of yoga in reduction of cortisol has also been studied. Then role of yoga in decreasing inflammation has been studied in various studies. Duodenal inflammation is one of the major factors in PDS, so it may also help in reducing inflammation. Then the practices that we have used, few practices can address the gut directly and few can address the psychological factors. So they have been discussed. Like Om chanting, Naishuddhi, just now one ma'am was talking on Om chanting, influence of Om chanting on heart rate variability. So that can influence psychological states like stress, anxiety, and depression, and as well as increase the vagal tone. Then practices like Surya Namaskar, Kapalbhati can have both physiological as well as psychological benefits. So practice of Surya Namaskar have shown highly stressed college students suggested that Surya Namaskar is an effective relaxation strategy as well. So we usually think stimulation practice, but it has shown relaxation also. Kapalbhati, even though parasympathetic withdrawal shows parasympathetic withdrawal during the practice, Malhotra et al. In this study observed parasympathetic activation after Kapalbhati. That's it. Artically, what I have discussed already, how yoga can help by increasing vagal tone, in short, and decreasing HP axis activity. So yoga therapy as an adjuvant is more effective than standard medical management in elevating symptoms of PDS, anxiety, and improving quality of life. Thank you.
Yeah. Garima?
Sir.
Yeah, here. Congratulations. It's a very good topic. It's complete in all aspects. Be it methodology, right from intervention, everything is so complete. I could not find any mistake except for finding fault that you did not finish in time. You exceeded your time.
Sorry, I'll take care.
All the best. If you can extend the study, and if you can include certain biochemical parameters also, it will add more value. But it is so good study. It's complete. All the best.
Used some questionnaire, 5 questionnaire. Did all are validated, pre-validated?
All are valid.
Well, already have
all
some
are-
publications. Like.
Yes.
Okay. Then one more question, one more suggestion is, you are producing some tables.
Yes.
So instead that many tables, you can put some juicy diagrams like bar chart and other thing. It can be very easily understand by them. So within that, you can say what is the p-value in that. So that is also very good.
Okay, sir.
Anything else, sir? That's all. Thank you.
Thank you, sir. Thank you.
The next presenter is Mr. Achudan.
Namaste to sir, madam. So today, my hearty thanks for the opportunity to given. Yoga Ratna Dr. Madan Mohan sir and my guide Dr. Meena Ramanathan madam and Dr. Ananda Balaji Bhavan sir. So my work is a part of my study, quantification of therapeutic effect scoring system in children with the autism spectrum disorder. So the yoga usually we are giving to 18 children, and some children are able to do some practice and some children are not able to do some practices. So rather we quantify all together and showing the image of outcomes. So there is something missing, I found. That's what this paper. Quantification of therapeutic effect of yoga in children with the autism spectrum disorder. So my guide, Dr. Meena Ramanathan madam, and Acharya Dr. Ananda Balaji Bhavan sir, and Dr. Pathiban sir, and Lakshmi Jatya madam, and Dr. A. Lokesh Maran sir, co-authors of this presentation. So background of this analysis is essential to know the following process of investing the self-effort. If we are putting something, investing 1 rupee and we are expecting the outcomes also the same way, investing some self-effort, what is that? How it is returned? We have to calibrate the outcomes also, whether it is really outcome of the self-effort invested. So optimal energy action, insertion of energies into psychic centers, and use of desired pranavagana for relieving energy blockages. So to know that quantification of energy dosage, so everything is dosage like 200 metformin, like 200, 125 mg, like that quantification is there. Here also invested self-effort, that is also quantified, should be quantified. So energy dosage is essential to know, and its relevant outcome measured as a physical, physiological, and as cognitive functions. So in this diagram, correct tool, of course, with the correct tool, we can able to reach the outcomes, but maybe less or nil. If we calibrate the potency also, more or less, if something low under practice, suppose for example, Tadasana is supposed to be done in 3 times and 30 seconds. This quantification is necessary. If this quantification is not, under this quantification also will not give result much effectively, and over also will give their overtired exhaustiveness. So that's why the correct tool outcomes give maybe less or nil. In the other side, if we go with the potency and there is energy dynamics will happen, and that will give the multiple effect. This is what the analysis of this paper. So aim and objective to quantify the therapeutic effect scoring system for yoga in children with autism spectrum disorder. So it's a main study, a part of my main study. The main study is that effect of yoga therapy on neuromuscular and cardiovascular function and reduction of autism severity in children with autism spectrum disorder. So the therapy was given 30 days. This protocol followed the same protocol, Playway, Jatis, and Tadasanas, Vrikshasanas, Padavasanas, 10 counts with the 3 times repetitions, duration. So the effectiveness, how we are going to evaluate after that, this is what the novelty of this analysis. The method of measurements calculates the percentage of invested self-effort for each yoga technique and yoga therapy protocol. The performance based on the key judging metrics. The key judging metrics is nothing but we have to predefine that 5-point scales were measured during yoga performance with physical and verbal clues, because the children are neurodevelopmental disorders. So we need to have physical and verbal cues. So based on this, we predefined some criteria like 4, 5, P0, P1, P2, and P3 and P4. So those who don't, and some are who performed with 25% of with the physical and verbal cues, and some are who performed 50%, some are 75%, some are 100% to the particular techniques. So it is based on each techniques. All the techniques of the yoga therapy protocol were measured based on the key judging metrics. So these are the formulas I used to bring out. So the formulas based on this, inactive participants, how we are going to we eliminate the score that is inside inactive participants of the particular techniques of the particular children's. So we have to eliminate that one then, so that we can get the score of the original effective outcome of the yoga therapy outcomes. So the total number and total performance score and performance percentage, error percentage and error score, active score. For example, the measures of error percentage and the performance percentage of yoga technique like Tadasana. If we take this total performance by children with the ASD, Tadasana, of 18 children, it gives a 28 score. So including the error performance percentage, it gives 39% only, whereas the performance percentage excluded means 41%. So the difference is there. So when we go with total 18 children of 15 techniques, so based on the key judging points, these are the key judging points. The evaluation of the therapeutic effect scoring system of 5 and the therapeutic effect of scoring system 4 by each technique and yoga therapy protocol in children with the autism spectrum disorder is coming like this. And the TESS, therapeutic effect scoring system of 5. 5 means including the inactive participants. 4 means excluding the inactive participants. Yes. The comparison of the TS5 and TSS4 mean only the difference is there, standard deviation difference is there, but the coefficient variation is same for both. So we can take it as a higher mean. Why not we can take a higher mean. So the overall mean was significantly higher than the mean of a test 5. Both systems showed very significant difference between therapeutic effect of yoga. The relation between the two systems is test 4 is higher than, means almost 25% higher than the test 5. The conclusion was the test 4 was validated and showed a higher therapeutic effect in the scoring system with the same coefficient of variation. Thus, the result indicate that the test 4 can replace the test 5 for the measurement of the therapeutic effect of yoga in children with the autism spectrum disorder. The features of this analysis is the measurement method can be used to find out yoga performance percentage of each technique as an amount of self-effort invested by an individual, and total performance percentage will reveal the accurate prescription of the yoga therapy protocol, and the performance percentage of each technique and the yoga therapy protocol can be correlated with the clinical measures, and the measurement method of yoga therapy protocol can be a significant tool for the development of a scientific research in yoga therapy. Thank you, sir. Thank you.
Congratulations, Achinandan, for making an attempt to create individualized yoga therapy for these disease conditions. I still have some queries. Can you go for the last bit, one slide, the futures of the study? Yeah, I have, as a layman, I have certain doubts here. One is like, if a yoga or an asana has to be done, it has to be done for a particular time in a correct posture. If for my comfort, if I'm not able to do it in the correct posture or for the correct set duration, will it be effective?
Expected outcome may be less or more, sir.
Then
That's
in that situation, you say that your test 4 and test 5,
yes, sir,
your test 4 score is going to be less than, it will be proving insignificant. Will it not?
Test 4 and test 5, the mean difference is there. 25% is higher. Test 4 is higher than the test 5, including the inactive participants is a little lower, 25%. And excluding that, that is 25% higher. Whereas the coefficient of variation is same. So there is no difference of the variation. Variance is not there.
No, the purpose of this study is to individualize yoga therapy, correct?
No, eliminating the inactive participants, the outcome must be more accurate. We are including the inactive so that we are reduced outcome only we are getting.
So you have 10 peoples, and out of 10, if you are having 8 people who are inactive participant and only 2 who are doing it correctly, you will be eliminating that 8 and including only the 2.
The data comes out of, no, sir.
Data is fine, but what is the effect? The main motto or the objective of giving yoga therapy is to give it to everybody, right?
Yes, sir. Giving yoga therapy is to all, but the measuring of outcome is very important. That is what the significant here it mean. Measuring outcome, it has to be little more, rather including the inactive participants where there is it's not happening.
Okay, fine. Okay.
There is some slide I seen like a P0, P1.
Yes, sir.
Before that. Actually, how we are going to assess this 25%? Is there any SOP, standard operating procedure?
Yes, sir. So that's what the asanas have some key points. The asanas have some key points. If the key points, they are reaching to that level, 20% or 50% or 70%, based on that.
Number of key
Yes, sir.
points, you can compile with that. Finally, you can achieve like 25%, 70%.
Yes, sir.
What is the error percentage you told?
Error percentage means included the inactive participants. Suppose the children who does Tadasana but unable to practice the Sarvangasana or Matsyendrasana like that. So one practice he is able to do, other practice he may not be able to do. The same way other children, the practice he do, the other practice. So here eliminating those 3 points, sir.
So in the particular asana, that person only, the particular asana only, that person eliminated.
Yes, sir.
Others, the person is very well done, means that person
yes,
will be included in that set.
Included.
It's actually quantification of yogas.
Yes, sir. Quantification.
That's
That's
good.
topic of the quantification of therapeutic system.
A good attempt.
Yes.
All the best.
Thank you.
Thank you.
Next presenter is Dr. Rajalakshmi.
Good evening to all. I am Dr. Rajalakshmi, practicing Siddha at Primary Health Center, Vidyapeeth, Government of Pondicherry. Before starting my presentation, I would my sincere gratitude to Director ISCM, Dr. Ananda sir, and Dr. Meena ma'am, and Dr. Sridharan, Department of Indian System of Medicine and Homeopathy, for the great support and their guidance. My topic is effect of integrated Siddha Yoga module on glycemic indices and body mass index in the management of type 2 diabetes. This is actually a part of my PhD study. Introduction. Diabetes, as we all know, it is a group of metabolic disease. It affects about 77 million people in India and about 537 million all over the world. And it is a global threat which should be taken care of. So Indian system of medicine, it proves effective in management of type 2 diabetes. Actually, Siddha medicine is a traditional system of medicine and yoga. We can say that Siddhas, they practiced yoga as a form of Kaya Karpam. But today in modern world, that part of yoga, which is practiced by Siddhas, was lacking to be practiced by Siddha doctors. So, thanks to Dr. Ananda sir, who suggested this topic. We thought of integrating Siddha medicine and yoga. Both are holistic traditional systems of medicine. They treat the individual as whole and not the disease. A short intro about Ayush, traditional and conventional system of healthcare. A for Ayurveda, Y for Yoga, U for Unani, S for Siddha and Savaragpa, and H for homeopathy. All Ayush systems of medicine, they treat the individual as a whole and not the disease. They all emphasize on diet and also lifestyle modifications. They insist on counseling. They have regeneration therapy. They gives importance to preventive care. That is, in Siddha, they used to say unave marandu marande unavu. So importance is given to diet and lifestyle. Siddha system of medicine is an older system of medicine. The term Siddha means achievements, and they concentrate mainly on 3 humors, that is Vata, Pitta and Kapha. If all the 3 humors are in equilibrium, we said that person is healthy, and if any disturbance or any imbalance in that, we term that person is diseased. So coming to the study aim, to study the effect of integrated Siddha medicine and yoga therapy on glycemic indices and body mass index in the management of type 2 diabetes. Methodology. This study was a RCT among patients who are attending Siddha OPD at Primary Health Center, Government of Pondicherry. 132 subjects were assessed, out of which 109 subjects were recruited and randomized to Group A and Group B. Group B is yoga group. N number is 54, male 25, female 29, and mean age 51.37 plus or minus 9.36 years. They received yoga therapy twice weekly for 4 months with standard Siddha management. Group B, it is a control group. N is equal to 55, male 34 and female 21, age 52.9 plus or minus 9.45 years. They received only standard Siddha medical management. All the subjects, they were advised proper diet and lifestyle modifications. Pre and post-study assessment were done. Fasting blood sugar, postprandial, HbA1c, body mass index were also done. All are done at GH, that is Indira Gandhi Government General Hospital and Postgraduate Institute, Puducherry. Approval was got from IHEC and registered with CTRI. All are obtained informed consent. Consent, that is all the assessment. 132 subjects were assessed, male 73 and female 59. After those are satisfying the inclusion criteria were taken to the study. The inclusion criteria are type 2 diabetes with taking Siddha medicine, only Siddha medicine, HbA1c between 7% and 10%, age 35 years to 65 years. Those are willing to participate and able to perform the technique. Exclusion are HbA1c less than 7% and more than 10%, and take those who are taking allopathy medication and those who have diabetic complications. Out of which 109 were recruited and they were randomized into Group A, yoga group and control group, out of which 54 patients, subjects were taken in yoga group and 55 in control group. Then after 4 months, all the subjects were assessed. These are the yoga techniques we have given at Primary Health Center by trained and qualified yoga therapists in a sequential order, which begins from prayer, then warming up, asanas, pranayamas, and relaxations. Yoga techniques were given according to the patient's flexibility. Results, baseline values were comparable in both the yoga and control groups. After 4 months of yoga intervention, intra-group comparison showed a significant decrease in all parameters. In control group, reduction was significant in postprandial and HbA1c and insignificant in fasting and BMI. Intergroup comparisons reveal significant difference between the groups with regard to BMI. This is a table which shows the comparison of glycemic indices of fasting, PBS, HbA1c, and BMI among 109 subjects before and after 4 months of study period. In FBS, that is a group A, that is a yoga group, it showed significant difference, whereas in group B, that is a control group, there is no significant difference. Whereas in PBS and HbA1c, both the groups showed significant difference. In BMI, group A showed significant difference, whereas group B, that is a control group, it doesn't show any significant difference. So we compared, so we wanted to see which group is superior. So we did delta percentage and we found that fasting, it was not significant. Postprandial is also not significant. HbA1c is not significant, but BMI we found that is, it has a significant improvement. Discussion in the study, the group A, all parameters have statistically significant difference between pre and post intervention, whereas in group B, only PBS and HbA1c showed statistical significance. To my knowledge, there is only one study which I found out, that too it is an observational study which integrates Siddha medicine and yoga, and also it integrates dietary modification. It has allopathic medicines also showed beneficial results in FBS, PBS, and HbA1c on type 2 diabetes. That study also recommends for clinical trials and long-term studies. BMI also, studies reported that yoga, in addition to standard health care, helps to reduce BMI and improve glycemic index and its complications. And also studies suggest that integration of Ayush with various health programs at initial level, that is, as I said before, it helps in preventive care, will be useful tool for prevention and management of NCDs in future. As recommended, this study is an RCT integrating Siddha medicine and yoga, which proves that Siddha medication is beneficial, but its potentiality of Siddha medication is further enhanced. That is, we can say as a catalyst, adding to yoga therapy, it proves significant. Strength of the study, this is the RCT. was first to evaluate the effect of traditional Indian system of medicine by integrating Siddha and Yoga, which is a major strength of the study, and limitation is this study is limited to a single center, and further multicentric studies with larger sample size and longer period of intervention, which will be needed in future. Conclusion. This present study of integration shows effective in reduction of all the glycemic parameters, whereas Siddha treatment showed significant result in PBS and HbA1c. It may be concluded that integrating both the systems of medicine complement each other, treating the patient holistically, giving positive results. Further extensive long-term studies should be done to assess the effect of integration of all the Indian system of medicines. There are also studies which shows the integrating Ayurveda and yoga, naturopathy and yoga also, which proves effective. Research is needed in areas of fundamental principles, diagnostic tools and clinical trials specific for each individual Indian system of medicine, so that it provides scientific evidence for development and promotion of Ayush, which is need of the hour. These are the references. Thank you.
Dr. Lakshmi, good study.
Thank you, sir.
I have few queries again. Now, first thing is, you are taking diabetic people.
Yes, sir.
Right? What is the duration of diabetes for these people?
New diabetic patients we are taking, sir.
So they are all newly diagnosed diabetics.
Yes, sir.
Sure.
Taking Siddha medications. Yes, yes, sir.
Have they ever tried allopathy medications?
Some may tried, sir, but I am a medical officer and in PHC Reddyarpalayam, those who are coming to me for treatment, I have taken them, sir.
No, my query is like, if you are taking diabetic peoples,
yes, sir.
My question is, were they being treated with allopathic medications?
No, sir, they are interested in Siddha, and actually in IHRC, we planned for 4 groups with the allopathy Siddha, only Siddha, and allopathy Siddha Yoga.
That will create contradiction.
Yes, sir. So that only our patients we are taking. Yes,
that is why I'm asking you. Were they subjected to allopathic treatment?
No, sir. No, sir. They coming for us.
So first time when they got diagnosed, they came for
Yes,
Siddha.
yes, sir. Yes, sir.
So they are all newly diagnosed
Yes,
people.
yes, sir.
And next question is, if they are newly diagnosed and if they have an HP value of 7 to 10, how efficient is Siddha medicines in bringing the HbA1c down?
Yes, actually, it is fine only, sir.
It is good.
It is good, sir.
Okay. Is there any other test you will be checking
Yes,
other
sir.
than this
Yes, sir.
fasting?
Fasting insulin we are taking. All the cholesterol profile we are taking. Renal profile I'm taking, sir. And also Siddha parameters. Naikuri, that is one parameter.
Okay.
Then Yaka Ilakkanam, that is body Prakriti I'm taking, sir.
Okay.
Waist circumference, all the needed BP, all the needed parameters I'm taking, sir.
Okay. Any C-peptide assay has been taken?
No, sir.
Okay, fine. Then you said proper diet will be
Yes, sir.
advised to the patient.
Yes, sir.
Now, what is this proper diet?
Diet means low glycemic diets, and then depending upon the Prakriti. That is, in my study, 83% are Pitta Prakriti patients. So depending upon that, I will advise them.
The biggest challenge in doing a research is to do it in a human being. In animal, it is very easy because everybody follows our own diet. That is why this question came. The next thing is like,
only thing is that, sir, weekly they will come to me because I have to give medicines for them. So through counseling, I will tell them.
Okay.
And through WhatsApp also, I am telling them.
Okay, but there is no true monitoring.
Yes, yes, sir.
It cannot be done.
Yes.
Next thing is like, did you measure their stress level?
Yes, sir. I'm having scales, PSS. The quality of life breath scale also I'm having, sir.
Okay. Any other biochemical parameters?
I told no, sir, that
biochemical
means glycemic indices like that. No?
Alpha amylase, etc.
No, sir, no, not
cortisol level. Okay, fine. Are you assessing them for any other endocrine disorder?
No, sir. No, sir.
Thyroid?
No, sir.
Because we know that there are other conditions which can also worsen the diabetic state. And all the best.
Thank you, sir. Thank you, sir.
Only one question, ma'am. You took for this study, this is a part of your study.
Yes, sir. Yes, sir.
You took only 4 variables: HbA1c, fasting, postprandial, and BMI. And you didn't find any significant delta analysis. There is no significant in
yes, yes.
3 parameters.
Yes,
only
on
one
BMI.
parameter. So what is your conclusion from this?
We can say that BMI is the main cause for diabetes. And morning speaker also, he told that hepatic insulin resistance also is there. So if yoga works on that also, it will be fine for to reduce the complications.
So your studies, this study is about 1 month or
4 months.
4 months.
4 months.
So it's very valid point that you are bringing down their BMI. So BMI if reduced, then automatically influence other parameters. Finally, we get.
If it is continued for long term, we can see the effect.
Yes. Good.
I have an advice. If you have to comment on BMI, then you will have to look for central adiposity, peripheral adiposity, and there are many other parameters.
Waist circumference only I'm taking.
No, many other anthropometric measures are there. All these things need to be taken. Yes. A person who is obese doesn't mean that he will end up in diabetes.
Yes, sir.
So you need to calculate many other parameters because BMI is very dangerous part. When you are commenting only on BMI, then it is very, very dangerous.
Okay, sir.
Okay.
You have given a lot of good pointers for your colloquial. The thing is that the reduction is there, but it is in both groups. So what I'm saying is, you say that Sigma is also already working good.
Yes.
So I think instead of saying there's no significance, the fact that Sigma itself is effective, you are sure. Like you have to remodel.
Okay, sir. Integration is fine. We can conclude.
So adding yoga is good, but it's not so much more beneficial than Sigma. You strengthen the Sigma.
Exactly.
That's another way out of it.
You need to be very careful when you are putting out these words.
There are some amazing suggestions to keep in mind because there is that here, there will be a lot of questions that we have to keep.
Okay, sir. Okay, sir. Thank you. Thank you.
And the next presenter is Dr. Nuzhat.
Good evening, one and all. I am a PhD scholar from Sri Devaraj Academy of Higher Education and Research. Today, I am going to present, my presentation is on the effect of pranayama and yoga nidra on improving quality of life in patients with cancer of the cervix. My guide is Dr. Nitin Kumar Patil and my co-guide is Dr. Sheila SR. Coming to the introduction, cervical cancer is considered as the fourth most common seriously threatening cancer in females. In 2018, there were approximately 570,000 cases of cervical cancer which were diagnosed, and there were about 311,000 deaths of cervical cancer. The estimated age-related incidence of cervical cancer was 13.1 per 100,000 women globally and varied widely among countries. Globally, the average age of diagnosis of cervical cancer was considered as 53 years, and the global average age at death was considered as 59 years. Cervical cancer is treated mainly with surgery, chemotherapy, and surgery, radiotherapy, which is supplemented by chemotherapy. During the treatment, the patient suffers from not only cancer, but also the treatment also causes many side effects in the patients. The side effects like nausea or vomiting, fatigue, pain, insomnia, diarrhea, loss of appetite, and constipation are commonly seen in these patients. Along with this, there are some psychological adverse effects seen in the patients. They are like anxiety, depression. So these anxiety and depression, if they are not treated, they may lead to suicidal thoughts in the patients. And all these things together, they can impact on the quality of life of the patient. So, complementary and alternative medicine is considered as a complementary therapy which is given along with the standard of care. Among these cancer patients nowadays, because of the stress beared by the standard of care, they are searching for the alternate procedures, and CAM is coming into use widely nowadays. So such approaches of CAM may include supplements, diets to combat maladies, lifestyle changes and interventions like acupuncture, nutritional supplements, and mind-body practices like yoga and meditation. Yoga was known to improve the physical and psychological symptoms and quality of life in cancer patients. Yoga Nidra and Pranayama are the forms of yoga. Yoga Nidra, it is a well-designed, systematic method that counteracts stress by creating a relaxation response. Pranayama was known to have many health benefits, especially in the mind-body illnesses. So, with this background, in the present study, we have evaluated the effect of Pranayama and Yoga Nidra on quality of life in cervical cancer patients undergoing chemotherapy and radiotherapy. Coming to the objectives of my study, my objective is to evaluate the effective of Pranayama and Yoga Nidra on quality of life in patients with cervical cancer on treatment. Methodology, it is a randomized control trial which was done for 1 year, and the sample size was 18. Experimental group consisted of 9 participants and the control group consisted of 9 participants, and experimental group was given standardized care along with 30 minutes of pranayama and yoga nidra twice a day, 5 days a week for 6 weeks. Whereas the control group was given only the standard of care. Experimental group was given standard of care along with yoga, whereas control group was given only the standard of care. Assessment tools used were EORTC quality of life questionnaire, and the data was assessed at baseline, 2nd week, 4th and 6th weeks. Inclusion criteria: histopathologically proven cervical cancer patients were included in the study, and stages 1B to 4A were taken into the study, and the age group of patients was between 35 to 80 years. Exclusion criteria consisted of patients who were suffering with HIV, musculoskeletal disorders, and patients who had history of major surgeries in the last 4 months. Coming to the results, the quality of life scores, global health status quality of life scores were compared between the groups, and for statistical analysis for comparison between the groups we have used Mann-Whitney test, whereas for comparison within the groups we have used Fredman-ANOVA test, and we have seen that there was a significant difference between the groups in the 2nd, 4th and 6th weeks in the experimental group. Significance was seen in the experimental group compared to the control group, and within the groups also the experimental group has shown a significant difference compared to the control group. Coming to the functional scale scores comparison, there was an improvement shown in the physical functioning scale, role functioning scale, emotional functioning scale, cognitive functioning scale, and there was a significant improvement in the experimental group in both between the group and within the group comparison compared to the control group. Coming to the symptom scale comparison, there was highest significance. Actually, improvement was seen in most of the symptoms in both the groups, but highest significance was seen in the experimental group compared to the control group. The significance in symptoms like fatigue, nausea or vomiting, pain, dyspnea was seen only within the groups. Highest significance was seen within the groups but not between the groups. And other symptoms like insomnia, appetite loss, diarrhea have also shown highest significance in the experimental group compared to the control group. Coming to the discussion, in our study, the baseline results of the patients will be always better compared to the post results of the patients, because in the beginning of the treatment, the patient is not exposed to the treatment, standard of care, that is the conventional treatment. Because of this reason, the baseline results of the patients will be better compared to the post results of the patient. In this study, similar to the previous study by Vadiraj et al., they have similar results are seen in this study also. Like the baseline results there was no much difference in the baseline results of the study, but there was a remarkable improvement in the complementary constituents and a significant decrease in the adverse effects of the yoga group compared to the control group. So the evidences have stated that the standard of care, along with the advantages, it has some physiological and psychological complexities like nausea, vomiting, pain, fatigue, diarrhea, dyspnea, loss of appetite, anxiety, and depression. These toxic effects of the treatment, they impact the patient's physical and mental health, considerably impacting the quality of life of the patient. So standard of care cannot be avoided because of these toxic effects. So these toxic effects are to be considered and can be dealt with simple, non-invasive and cost-effective therapies like yoga. So evidence suggests that yoga reduces physiological effects like nausea or vomiting, pain, fatigue, diarrhea, dyspnea, loss of appetite, and psychological effects like anxiety and depression. In this study, Yoga Nidra and Pranayama are used as magical implements to reduce the physiological and toxic psychological effects and also help in increasing the patient's quality of life. A study by Anand Dhruva et al. Has stated that Pranayama works with mind and the organs of respiration. It is a cost-effective technique and creates a relaxed state by enhancing the parasympathetic tone. Pranayama, it is free of side effects and is also useful for alleviating common chemotherapy-associated symptoms and also helps in improving the quality of life of the patient. Reshma D. Kunha et al. Has stated that Yoga Nidra helps in secretion of cortisol. So the elevated levels of cortisol in blood will cause inhibition of the immune response, which alters the body's ability to resist cancer. A study by Divya and Anand et al. Has stated that Yoga Nidra could provide complete physical, mental, and emotional relaxation. Reshma D. Kunha et al. In their study affirmed that Yoga Nidra reinforces debilitating stress. Chohal A. inferred that yoga relieves physiological and psychological symptoms, which in turn enhances the quality of life of the patient. So based on the studies of Cam AJ et al., Bertson GG et al., and Yesuma F et al., confirmed that pranayama, which consists of prolonged expiration compared to inspiration, may increase parasympathetic activity. So based on these evidences, these evidences are suggesting that yoga can be used as a supportive therapy in addition to supportive therapy to the standard of care to reduce the side effects and to improve the quality of life of the patients. So thereby I conclude that Yoga Nidra and Pranayama can effectively improve the quality of life in patients with cervical cancer who are on treatment, that is standard of care. These are the references. Thank you.
So few questions.
Yes, sir.
So why only 18 samples?
Sir, actually, that was the period of Corona, sir. So I couldn't get the patients more, sir. That was the reason I collected. Actually, my main study is with 70 patients, sir.
Okay.
So this is separate, sir. It's not a part, sir. It's separate, sir.
Separate. Then many places I seen non-parametric like Man Whitney and other Friedman and over like. So in that situation, you have to show the median value. You show like means, rank and everything. That is okay. So instead of mean and standard deviation, you have to use median and IQ.
Sir, Z value, statistician has informed me that Z value is like, it indicates like how many, like Z value is enough. You can show that instead of like how much the
median and IQ, instead of that, you can use Z value. Have you shown everywhere Z value?
Yes, sir.
Yes. Then it's okay.
Yeah, Nasrat, it's a good study.
Thank you, sir.
Because to find people's to improve the quality of life in patients who are terminally ill, it's a sacred treatment which you can give. And I can see that very good results have been coming out. And in your discussion, you have mentioned certain points, but that was not if you can correlate it with your study, it will be much more better. Because you mentioned that the symptoms which are seen in the patient with cancers are all due to drugs rather than the cancer per se. But I see all those things as sympathetic overactivity rather than the complication of the drug. Because anybody who is having a cancer is not going to be free of mind, be it diarrhea, increased breathing, dyspnea, all those effects. And all those effects are getting better when yoga nidra has been given to them. So if you can also assess these people's autonomic status, the quality, the importance of your study will be much more better. Yeah.
Sir, it's like I'm dealing with the patient since nearly 2 years, sir. But I have seen, sir, like dyspnea, but none of my patients have complained of dyspnea, sir. I particularly asked them for that symptom, but none of them have complained that they are feeling breathless or something. So that is the one thing I have noticed in my patients, sir. I don't know for what reason, because I have also seen the literature, and because of that, I particularly asked them, but none of them have complained. They say, I'm fine, sir. Most of them.
But you have mentioned that dyspnea is
when they walk for a distance, that's what I'm about to tell, sir. When they go for on exertion, they'll have dyspnea. Like if they go from the next day of chemotherapy, when they walk from the treatment section to the ward, they felt dyspnea, like dyspneic, but not always, sir. Like most of the time, they don't feel dyspneic. Only when they walk from here to there for a shorter distance. Sometimes on the next day of chemotherapy, they mostly complain like, if I take one round, we'll tell them to go for walk and also. So they say, if I walk, I'll feel dyspneic. That too, other days they may not come, they will not complain, sir. But the next day of chemotherapy, they have complaints, sir. Most of the people.
Usually happens.
Sir.
Usually happens.
Happens because there'll be always fatigue. Because of that reason. And autonomic function test we are doing, sir. HRV, I have one more parameter, HRV, that is still on analysis, sir.
Yeah, if you can correlate that with this parameters, it will be much more effective.
Okay, sir. Okay, sir. Thank you so much, sir.
Our next presenter is Mr. Nilachal, the last presenter of today.
This one D1. D1. I will see. Okay. Yeah. Okay. Very good afternoon to one and all. So my paper is on yoga therapy and cultural appropriation, a general overview, a definition kind of paper, where I'm trying to focus on the aspects the yoga therapy and cultural appropriation have. And going to the background of this, we have like what the cultural inappropriate. When we're going to the definition of the cultural appropriation, we get the definition that the inappropriate or unacknowledged adoption of a cultural element by members of a different cultural identity is known as cultural appropriation. And in the field of yoga, we have observed with yoga therapy. And because of the holistic nature of yoga, where it can be used as a preventive, curative, and supportive role, there are many new techniques that are coming out and without acknowledgement. So this is the background. And by going through the background of this, a few analysis of the papers, a few history of India, if you go to see, there are some similarities and there are some things that tricked in this research. And do great minds think alike? And their questions comes and may they come with similar results. So there are some things. So the Newton law of motion that we all know, but there is a resemblance in the Vaisheshik Darshan. Similarly, the Wright brothers we all know. So there is a similarity in the Tripura Viman Shastra. Similarly, the concept of chemistry, we can found the distillation process in our ancient Indian texts. Similarly, the mathematics has also resemblance in the form of square roots and the Pythagoras theorem that we all know in the form of the Bodhyan Sutra. Similarly, if we go to the Ayurveda, the branches of Ayurveda that we see, different branches of body treatment, ENT, surgery, we see similar kinds of specialties are also in the medical field. And the concept of the Vata, Pitta, Kapha that can also be resembled with the concept of humors that was given by Hippocrates. Similarly, the other Indian text has various kinds of knowledge that we see in today as well. And now coming to the plastic surgery, if you see the plastic surgery that modern science uses has a prehistory where we can see the plastic surgery of nose by Acharya Shushruta in the Shushruta Samhita, and there is a detailed explanation of these and how these things were used to do. Similarly, intestinal surgery were used to see, and the instruments that are used today are also the resemblance, or they are the advanced forms of the instruments that were used by the Indian surgery in the ancient times by Acharya Shushruta. So similarly, if we see in the physiotherapy, we have the resemblance of these postures that see alike. And the question is, these are the practices and these are the resemblance. There is a need. Are these the similarity by chance, or it is being something like we have copied from? So there is a need of acknowledgement. And if you see yoga therapy, we need to understand what it actually is. So it is basically a biopsycho-spiritual process, and it is a process of empowering individual in a holistic manner. And if you see yoga therapy, as it is a very small component of very vast ocean, and it has to be taken in that way, and it has to be applied. And when things are taken from the yoga perspective, we have to see it in that way. So by looking all those previous things, we see that these are the serendipity or the intellectual property theft. I don't know. Let's see how we can find out through the observation. The evidences. And the result that I came upon is that there are some practices which are using the practices of yoga therapy, and they're not acknowledging them. So some of them are, if you see, there are many practices that looks like yoga, and actually they mention many the techniques, but they don't call it the yoga therapy, or they have not acknowledged it. The one of the practices are is the cardiac coherence breathing, which is nothing but the pranayama practice. The yoga nidra practice of ancient Indian yoga therapy, it had been renamed, or it has been copied by the name of I-rest, integrative restoration. Similarly, diaphragmatic breathing exercises that has been practiced, it has not acknowledged yoga, the practices, the breathing, the pranayama practice, and it uses those. And in the Gitananda Yoga tradition, we see the Vibhaga pranayama practices where the sections of the 9 sections of the lungs are being utilized, and they are practiced long back before the practices that have been introduced as the diaphragmatic breathing. Similarly, the bibliotherapy that we see today is very small practices of, in a very small nutshell, the very small part of a swadhyaya, which is being practiced, which is mentioned in the Patanjali Yoga Sutra, which has been like 2,500 years ago. So similarly, it has to be acknowledged. Mindfulness, the dharana dhyana practices which has become the mindfulness. It doesn't acknowledge yoga for its practices. Similarly, awareness through movement, a new form of techniques are being used. They use the different practices as a flow and for the relaxation and bringing the awareness of the person. And they does not acknowledge, but they takes the components of yoga. And if we see in terms of yoga, we have many flows like the Surya Namaskar in the form of asana and kriya. The Chiri Kriya, we have the asana in the form of Surya Namaskar, that is a complete flow. And there are other yoga vinyasa series, they have flows of the practices, and this we can see. And coming to the conclusion, we have like yoga, the practices, the only thing that we need is to be acknowledged. The practices are immense and it can be included in the modern technique, and it has many practices which can be integrated, and the effects can be in a very higher or beneficial in a more effective way. But we see yoga as something which can overwhelm us, or something which is very much of entertainment. But let me tell you, it is not. Yoga is an ancient practice which was practiced for if we say take the definition of yoga, it is yoga samadhi. The ultimate goal was to attain the samadhi, higher conscious state, mood chipt ekagra nirudh, that state of the mind. But for the time being that I showed you the yoga therapy, the small component of the whole yoga ocean. So for the therapeutic approach, we have to say in that way, and it has to be applied for the holistic wellness of the person, how it can bring from the illness to the wellness section. And we see the practices like beer and so-called, like they have used the yoga term. So they got yoga. They are not actually the yoga practices. And so if you see that here are 4 types of bottles, if you see, the original one is the Bisleri, but if I remove the fake symbol, you will not be able to differentiate on the first side. And these practices, by taking the benefit of the name of yoga, making it as yoga is very much popular, they wanted to take the brand of yoga and providing the not yoga practices. So very much important to understand what actually yoga is and how to appreciate and not appropriate yoga. So as the example of the water, if we just see the bottle of water, we see the water in it. If you see, if you not understand where it comes from, what is the original source of the water, we will not able to understand the importance of water. If we will show a water bottle to a new generation, and with the person, the child will not know where the water comes from. The bottled water is the only source. A bottle is the only source from we get the water, or the tap from where we get the water. But in reality, the actual source of water is somewhere else. The rivers, the oceans, that are the actual source of water. And to maintain the integrity, the ancient tradition, which is actually the thousands of years of indigenous wisdom, and it is a combined amount of time, effort, dedication, research, teachings, self-introspection, a lot of things happened, and then it came to us as a form of yoga. So to preserve our culture, to preserve our ancient tradition, it is very much required to have this yoga therapy to be acknowledged, because it has immense potential. It can be integrated with any therapies. Most of the therapies, it can be used as a preventive, supportive, curative role. And the concept was always like Vasudev Kutumbakam, like in our text says, and to the whole world is family and yoga is for all. And the only thing is we need to acknowledge the ancient yogic tradition. That's all. Thank you.
Yeah, Nishal?
Yes, sir.
Good work in searching the literatures, comparing with other studies, other practices which are being done, and then putting out your anger in a very sensible way. Thank you.
Thank you, sir.
So it was interesting. One thing, the physiotherapy, you can see They are very much like yoga practices. Now here appropriation and use some other term, I forgot that.
Appreciation.
See, the one thing is there are some people who say everything Indian they have copied. That's extreme. But many things have originated from India and gone there. So Arabs and European. For example, there was one chat, GP chat. I don't know how to do it. Somebody sent me. The 3 laws of Newton. They're already our one of Darshan Shastras. But the point is now the Newton, so they say Newton has copied it. So one thing there, 1 minute. It is not necessary. He may have, as you say, the serendipity. That also matters here also, there also. So there are 2 things. One thing is deliberately they ignore original source. Others, they do not ignore, but they are not aware. That's also there. So you have to make aware now at this point. And one thing, about 15th century or so, when the missionaries came here, French missionaries, before Britishers, they have taken the book Rigveda here. It was a big issue. It was there. Because the French, it was officially planned. And they searched, they took years, 20 years to search the full Vedic. Now it is available now. That time is not. And so they won there. And mainly it was Berlin, mostly. Though French, but Germany, they have collected ancient Indian books. And now, modern time, Veda was resurrected from Germany, they got a copy. So there are both ways are there. Some people deliberately do it, maybe. Some people say, no, Europeans have copied. It is not necessary, isn't it? So one is open, both are there, isn't it? But mixing has been there, no doubt. Now, one example is 0, for example. 0 decimal is it's an Indian invention. The numbers are called as Arabic numerals. Why? Arabs have carried the West from India. Now they come from Indo-Arabic. Why Indo-Arabic? Indian. Only shape varies slightly. 1 to 0 decimal is Indian invention. It's Indo. So that's even India also the shape varies slightly from language to language. So you have to give, but your people must be aware. Give source. No, this is the original. This is there. Okay. And Newton also done. Europeans done. They know the Europeans done a lot of work. Original. And we should not belittle it or demean it. They have done within 2 or 3 years. Germany has done so much work. German philosophers, scientists, unbelievable. Till Hitler destroyed the whole thing, made it. They have done so much work. Philosophy, science, mathematics, art, culture, music. So much work they have done. Ancient India has also done that time. So we have also original, Europe also done. All have done. And you see why the original is there. Let people be aware. That's all it is. Was it appropriation or misappropriation or
appreciation?
Adaptation, whatever it is.
Appreciation. Thank you.
Nice.
Thank you.
You have stated animal assistive therapy is not that appropriate. Could you quote some studies which actually says it is not significant?
See, my study here is that the concepts of yoga are actually the thing that are being practiced. In the traditional ancient yogic text, if you see, there are no any evidence where the animals are being used for the practice of yogasanas. And yogasanas or the other yogic tools are self-sufficient, that they does not require any other things like the animals, or in the case like beer yoga, they don't require the beer. And they're actually selling the beer instead of the yoga. In the name of yoga, they are selling beer. So just to make it more fashionable and just to make it more different, that is being used. So if they are using that, that is not actually the yogic tradition that they are using. That was my point. And they are doing like somewhere the animals are being used. So I will say that they're using the name that is not actually the yoga that which the ancient yogic text defines. That's it.
But then evolution sometimes helps, right?
See,
I mean, like in I'm not belittling Ayush, but then in casualty, allopathy only does a significant thing like that. Like I'm saying, like adding something evolutionary thing will help in like improvising thing. Like we are not actually collapsing yoga, we are just adding it up. I don't think it's appropriate to say it's not significant.
See, that will be a kind that just like the bottles that I showed there. So it will be the other kind of the bottle. The Bisleri has the good quality minerals that we see. It is of good quality water. If we see something that has not been used properly, the concepts, the principles, the actual teachings, it will not actually fulfill those things. Like if we go to the definitions of yoga, yoga chitta vritti nirodha, we will see. So if we will do the practice something which is not doing the chitta vritti nirodha, how can you call that yoga? So the thing like yoga samadhi, like the definition of the yoga is not fulfilled, then how it can be called yoga? So the using of that word yoga itself is not appropriate there. So that's why we can't call that yoga. Call it other name. Other names can be called, like you can call it other therapy that can be used, that can be using the animals, but it is not yoga. That's all.
I think we can close that here. You can have a private discussion because this is a hot topic. Why Nilachal has taken it is it's a very hot topic for me, so I don't even want to comment on it. Otherwise, we'll have a 2-hour lecture. But we would like to conclude for today and appreciate all our participants. Let's give them all a very big round of applause. And some of you have been lucky also. Madan Mohan sir has been here to listen to a bit of it, and both our judges have been amazing. They have really been amazing, giving very constructive suggestions for all the participants. And especially as many of you are doing your PhD currently, please take those suggestions to heart so that in your public viva, you can deal with all these type of questions, because these are the type of questions that will come up in a good public viva. So, you can anticipate, and either you can go back and rectify things. If not, at least start to prepare a good answer when those questions come. So either rectify or prepare good answers. Both are possible. So we'd like to appreciate our 2 jury members. So I request you to come to the dais, and we give a memento on our side. Sir, up. It comes. Please come back. In front of the lama. Please, sir. Just a second. I really appreciate it. Memento. You are in site as a organizer. Janet is getting good memories of SBV. And Abdiya, if you can just sit here 1 second, can I have all the presenters please come for one group photo? We have Madan Mohan sir here. We have a jury. Sir, up center, sir. Center, Janet. Please come. Can all come so that we are here. Get a nice photo. Are we all here?
Bhuvaneshwari. Ma'am.
Okay, the photo on the other side. A, B, C, D, E. A, B, C, D, E. Long way, I was. We'll be concluding with the Shanti Mantra and then invite you all to come for tea. Yeah. For three of our presenters who have come from Chennai, as they will not be here with us tomorrow, I believe, so we'll give you a participation certificate. Prize certificates will have to await stuff for later, but L. Smriti, please come. Harita Dhanasekar. Ashwini Maran. அப்ப மணி சார் நாளைக்கு and Dr. Sumitra. Dr. Divedita. A separate certificate will be coming to you by email also, where with the title of the paper you presented, a separate certificate will come. Because we were awaiting the title of the paper, we couldn't do that. So we'll do. Yeah, okay. Professor Mani sir. Yes. அப்ப உன்ன என்ன ரெண்டு பேரை தான் பிரசன்ட் பண்ணோம் அவ்வளவுதான் வாங்களா நீங்களும் வாங்கிக்கங்க லெட்ஸ் கம்ப்ளீட் த சைக்கிள் கம் நீ பிளாங்க் சர்டிபிகேட் கொடு போட்டோ பாத்துக்கலாம் கம் இல்ல ஏன்னா நாளைக்கு சாரோடைய டைம் டேபிள் தெரியல நிலாச்சல் Dr. Rajalakshmi. Thank you, sir. And Garima, sir. அவங்க இல்ல you just take one with sir because getting a photo with sir is a treasure. So even if tomorrow this is without the name, but we'll give you one tomorrow for her. Please come. Devraj Bose. Nitin, Dr. Nitin's student. Photo, sir. Sir. Yeah. So we'll conclude with the Shanti Mantra and then have a cup of tea and meet again tomorrow 9:30 here for those who can be here. Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, Ma kaschid dukkha bhag bhaved. Om Shanti Shanti Shanti. Om. Thank you and see you all tomorrow. And please have a cup of tea and have a nice time tonight wherever you're